Hi everybody, Tim Emerson from Kuan Yin Healing. Nearly 1 in 3 Americans suffer chronic pain from a wide range of injury and disease at a cost of $600 billion annually. The National Center for Health Statistics reports that 2/3 of these people experience pain daily with a severe impact on their quality of life. 3/4 have low energy, trouble concentrating, and depression. 6/7 report an inability to sleep well. That's most of them, and it means that over a quarter of all Americans can't sleep well because of chronic pain. Over half say they have little to no ability to control their pain. And yet, the National Institute of Health notes that half the people with the most severe pain, or pain as the disease itself, still rate their overall health as good, or better than good. Ever see people discussing their pain? One says his knee hurts, right? The next says, oh, that's nothing compared to her headaches. And the third says, oh, I'll be glad I don't have this back pain. And whoever has the most pain wins. There's no real incentive to treat pain if you feel you're in good health. So we do the next best thing. We treat the symptoms. And that generally means, or at least includes, drugs. Pain is the second largest pharmaceutical category after cancer drugs. Now, in most countries, the use of opioid prescriptions is limited to acute hospitalization and trauma, such as burns, surgery, childbirth, and end-of-life care, including patients with cancer and terminal illnesses. But in the United States, every adult in America can have a bottle of pills and then some, according to the U.S. Surgeon General. Doctors write 300 million pain prescriptions a year. That's a $24 billion market. With less than 5% of global population, the U.S. consumes over 80% of the world's opiates. We consume 99% of the Vicodin, and 40 people a day die from prescription opiates. Yet, the National Safety Council reports that 99% of physicians exceed the recommended 3-day dosage limit, with a quarter of them writing prescriptions for a full month. Mainly primary care doctors. Certainly, not wanting people to go through the constant expense of a visit, presumably. It sounds reasonable. Accidental overdoses, though, from Vicodin and other narcotic pain relievers kill more people than car accidents in 17 states now, according to Thomas Freedom, Director of Centers for Disease Control and Prevention. Over 24 million Americans are addicted to opioids, according to the National Institute on Drug Abuse. Some move on to heroin as it's considerably cheaper. In non-narcotics, according to the American Pain Foundation, 1 in 3 Americans over 65 take aspirin, ibuprofen, or naproxen daily for chronic pain. Now, these drugs block prostaglandin production, those hormones that set in motion the healing process. Yeah, ironic, no? We actually subvert the healing process. Painful menstruation, heavy menstrual bleeding, arthritis, and some kinds of cancer, according to the Hormone Health Network, are all connected to excessive prostaglandin levels, so blocking these reduces inflammation and hence pain. But prostaglandins have a job to do, like protecting the stomach lining from stomach acid, so eliminating them causes stomach bleeding. Now, newer NSAIDs that address this by targeting COX-2 instead of COX-1 enzymes turn out to increase the risk of heart disease and stroke. And all NSAIDs damage the kidneys over time, while acetaminophen damages the liver. It turns out you can't attack your body's healing mechanism without ill effect. Doesn't make much sense, does it? I have great respect for doctors and Western medicine. If you need a crisis intervention, these are the people you want. No one does acute care better. But chronic conditions pose a special problem. They have holistic causes. Science works and works well by isolating an aspect, testing it, and with verification, advancing knowledge and medicine. That's great when you've broken your leg, we know the problem and what to do. It's not great when your own body is apparently the cause. This is why, as the National Center for Complementary and Integrative Medicine reports, over 30% of adults use alternative medicine every year. Other than medication, medical doctors generally don't do pain well, so pain sufferers seek other options. But it's not the fault of the doctors. It's the nature of pain itself. And next time I'm going to talk about exactly that. What is pain? By the way, if you'd like to get a copy of 10 mistakes that keep people from finding the healing they want, just click the link below. See you next time. We'll talk about what is pain. Take care.